along the way. Thank you everybody for coming. This, as you guys know, is an OSIG event. We decided to make this event because diet and nutrition right now is a very trendy topic. You can hear a lot of people and professionals speaking about it. And so we wanted to link it with our interest, which is cancer. And with the help of our dear professor, Dr. Babek, who graciously decided to join us and even proposed the idea to us, we thought it would be a wonderful professional discussion that we can go into. Dr. Babek, thank you so much for joining us.
Thank you too.
So in order to understand this topic enough, we wanted to create some form of introduction. So I made a short slide for everybody for us to go through very quickly. And then after going through this slide, we will proceed to have a short Q&A session with Dr. Babek. And then if any one of you guys have any questions to ask, we will have a short Q&A session as well for that. So let's just proceed immediately to the short lecture about diet and fasting and its effect on cancer. All right, so can you guys see my screen? The PowerPoint presentation?
I do.
Okay, perfect. All right, so let's start very quickly. So this presentation, as I said earlier, is about the effect diet has on cancer. And I made this figure myself. It's my own drawing. And I just wanted to remind everybody about some basic biochemistry. So in our body, there's acetyl-CoA. It's usually stored in the liver. And this acetyl-CoA is a source of energy. So if we have lots of glucose in our bodies, this acetyl-CoA will be broken down through the TCA cycle and then undergo glycolysis. However, if there is low glucose in the body, what ends up happening is that we form something called ketone bodies. So very simple, high glucose, glycolysis, low glucose, ketone body synthesis. And so it makes sense that insulin, which is the well-fed hormone, prefers the formation of glucose and the TCA cycle, while glucagon, which is the fasting hormone, prefers ketone body synthesis. So now that we understand that a ketogenic diet prefers to form ketone bodies rather than carbohydrates and glucose. So what is a ketogenic diet? A ketogenic diet basically is a diet that prefers to mimic a fasting state. What it tries to do is minimize on the amount of carbohydrates that are present so that we form ketone bodies instead of forming glucose intermediates. And so it makes sense as a result that a ketogenic diet will have high amounts of fat because fat is a precursor for ketone bodies, and it will have low carbohydrates and adequate amounts of protein. So this is a very simple introduction about what a ketogenic diet encompasses. So we're talking about the effect of diet in cancer. So how does a ketogenic diet affect a malignant cell? Well, in order to understand that very quickly, we have to go back to basic cancer pathophysiology. And for the first year students, I urge you to focus well here because I know these are very new. This is very new information for you. In a normal body cell, in a healthy cell in a human being, if there is oxygen, the cell decides to generate energy through the use of this oxygen. And this is referred to as oxidative phosphorylation. So in the presence of oxygen, the cell generates energy through oxidative phosphorylation. However, if there is no oxygen, then the cell has a backup way of generating energy, which is glycolysis. So this is the normal cell. It has a backup method and an original method. On the other hand, for cancer cells, there is only cancer cells, whether there is oxygen or no oxygen, cancer cells prefer glycolysis. And so cancer cells love glucose. This is the take-home message from this slide. Cancer cells love glucose. So when you adapt a ketogenic diet, what you're doing is you're limiting the amount of glucose that enters the body. And as a result, you are starving the cancer cells, while your normal cells are using oxidative phosphorylation. They don't need glucose anyway. So it's a way to specifically target the cancer cells. At least that's what the research tells us. And let's now look at some of the research. There's research here mentioning how in most cancer cells, there is accumulation of lactic acid. And when patients adopt a ketogenic diet, the levels of lactic acid diminish in the tumor tissue. So that means that ketogenic diets can decrease the tumor burden in a patient. In addition, people have mentioned that, or studies have mentioned, this one in 2014, a study has mentioned that a ketogenic diet can be a therapeutic option for many diseases, including obesity, diabetes, polycystic ovarian syndrome, acne, and neurological diseases as well. In addition, intermittent fasting is also part of this research. People have postulated that we have had evolution, and our ancestors were used to a starving condition. They did not have food available for them over and over again. And so when we are in a fasting state, we are more alert mentally and physically. And these studies mention the cognitive effects of intermittent fasting. All right, so what about cancer? Because this is what we're here for. So there are many studies talking about the relationship between ketogenic diets and cancer. For example, this one published in 2018 mentions how a ketogenic diet has a synergistic effect with radiotherapy in cancer patients, which means that it helps radiotherapy become more effective for cancer patients. And this is a review article. As you guys can see here, the green color represents an anti-tumor effect that is proposed to be caused by a ketogenic diet. So as you guys can see, for multiple tumors, whether glioblastoma, astrocytoma, colon cancer, pancreatic cancer, the effects of a ketogenic diet are very evident, especially when combined with other adjuvant therapies, with other chemotherapy or radiotherapy. So the research also includes the effect of intermittent fasting. For example, in one study, mice who were exposed to a ketogenic diet, as well as radiotherapy, reported a decrease in the breast tumor burden in mice with breast cancer. And similarly, when a ketogenic diet was combined with radiotherapy and chemotherapy, the tumor burden of brain tumors like gliomas have also decreased. So we have mentioned a lot of potential positive effects of ketogenic diets and intermittent fasting, but are there any adverse effects? Well, there are some reports that were accusing the ketogenic diet of containing too much fat, and so they were worried that it might increase the blood cholesterol levels. But surprisingly, in people with atherosclerotic disease, blood cholesterol levels and blood glucose levels have been shown to decrease or improve significantly on the effect of a ketogenic diet, which means that as of right now, this is not really a disadvantage. But here is actually the main disadvantage, and this is the last slide here. It's the fact that ketogenic diets and intermittent fastings have not been studied enough yet. There are no randomized control trials. Now, randomized control trials are very important because without them, you cannot mention whether a diet or treatment modality is superior to placebo. So until we have a randomized control trial, we cannot start recommending these dietary and nutritious plans to other patients. And this is genuinely the only disadvantage that we have. So after this small introduction, now I would like to have a Q&A with Dr. Babek, who is a surgeon who has a particular interest with obesity surgery, and he's interested in particular in nutrition. Dr. Babek, thank you again for coming. And we can start now. We can start with the Q&A right now. So, Dr. Babek, according to you, do you think diets generally can increase or decrease a person's risk of cancer?
Sure, yes. Sure, yes. Let me start with the point that this is an educational meeting. So none of the things that we mention here is for just or having it as a rule for making the therapy. Okay, so this is the first thing that I wanted to mention. And the second thing is that so we have to just be open-minded. We have to widen our horizon of thinking about the possibilities that the things that we have learned in medical school 10 years before or 20 years before might not be right. And all of the researchers and papers that had lots of maybe index, you can see that not all of them are designed very well. So always you have to be aware about the things that you in mind, and don't forget that when you do a research, you have to protect yourself from becoming a fanatic of your search. If you think that the alkaline diet is good for cancer, just try to be open-minded to the fasting or to the ketogenic diet. And if you are doing a research about the ketogenic diet, don't forget is the only cause of all of the problems inside the body. Okay, so keep in mind that we have to be open to everything, and especially for the younger guys in this, that we are not fanatics, and we always keep in mind that there are lots of things that we don't understand. Now we can call them as supernatural. Medical terms, maybe idiopathic or things like that, but all of them has causes, and for now we don't know them. Okay, so how about the cancer? What is cancer? Life. What is the cell? It is just a try to live, a try to resist against death. And if you go very for example, 1 billion years ago, there are just bacteria. And if you go maybe 2 billion years ago, there are just bacteria that can't do oxidative phosphorylation. Okay, they just do the chemosynthesis. And there's no death at that time. There's just coupling of the cells. So coupling of the cells and trying to survive is the key to life. And this is the meaning of cancer. This is the meaning of cancer. And when you come to the new era of life, when the multicellular organisms and the bodies, and after that maybe dinosaurs live, you can see that for living now we have change of the cells, and we have some fossils from the dinosaurs that they have maybe bone cancers and so on. So cancer is the reality of life, and there are cells that tend to live forever. None of us are going to live forever because we are multicellulars, and that is a reality for us. So cancer is trying to survive. This wise, this flexible, unfortunately, and as you mentioned, for sure, it loves glucose. And because of the Warburg effect, so it needs lots of glucose. It is not right for all of the cancers. It is right for most of the solid cancers, not for the liquid ones. And not all of the really glucose, and when you just stop giving glucose, they very, very fast try to just upgrade their metabolism, and they start to use protein. They like the glutamine. When you just cut the glucose, they're going to regress, but in a short period of time, they adapt to the new type of feeding, and then they can use the lactates, they can use the glutamine and things like that. Okay, so it is not that cut the sugar, no need for chemotherapy, no need for radiotherapy, and just go for ketogenic diets, or go for fasting or intermittent fasting, and then you're going to get rid of the cancer. Because the aim of this meeting is that our science about cancer just still has its place. Okay, we need to schedule the therapies. We need to just make the right diagnosis about cancers. We have to go for the advanced diagnosis and make the genetic testings and know what type of cancer, and after that go for therapy, surgery, chemotherapy, radiotherapy, and so on. But keep in mind that yes, with feeding we can help that therapy. This is not an alternative therapy. This is not the alternative medicine, which I never agreed with that. If it's working and we use it, it's medicine. If there's no proof for that, so it's nothing. Okay, so in medicine we use the diet as a part of our treatment, and for sure in cancer treatment we need to help our treatment with the diet that can help normal cells survive, can support our normal mitochondria, because this is the most important part. And we have to reduce insulin, because insulin and IGF, insulin-like growth factor, are the very important growth factors for hormones. And if you lower them, you can just reduce the velocity of the. So if you cut the carbohydrates, you're going to just reduce the amount of insulin and IGF. This is a way. But still, it's the fact that lots of protein is going to feed the tumor. So you have to lower the glutathione also, because lots of protein is going to cause lots of mTOR. And for the younger friends that are inside this meeting, you have to open your maybe internet and so on, and just have a little search about the TOR and mTOR. Okay, so these are important parts. It's not only not taking the glucose, but the protein is still important. But when you go for a ketogenic diet, it's not like Atkins diet. You're not going to just consume lots of protein. You try to take your energy from fat, and for sure from the saturated fats. So yes, but for sure you're going to need lots of vegetables because you need oxidation. Okay, this for me it's enough for the start, and we can go with the questions, and after that I can talk about something else.
That's a wonderful start. Thank you very much. Just in case for the students who could not hear properly, as a very quick summary to what Dr. Babek has mentioned, we have to take this with an open mind. We have to be flexible. This is not direct medical advice. Instead, this is a discussion about how things are changing very rapidly, how dietary patterns are changing very rapidly. And what Dr. Babek said next was that yes, cancer likes glucose because cancer are living cells that are trying to survive, just like we are trying to survive. And from the latest research, we realized that, okay, cancer likes glucose and it likes to feed on insulin and insulin-like growth factor. But even with the diets that completely eliminate glucose, it doesn't mean that we are completely destroying cancer, because cancer will adapt just like we adapt and will try to consume protein, mediated by effects, as he mentioned, with the mTOR and TOR genes and proteins. So this was just an overview for those who were not able, for those whose internet connection was not enough. So Professor, for the next question, we want to ask you how, like in the past, it was thought that, okay, the ideal diet is breakfast, lunch, and dinner. And they used to say things like breakfast is the most important meal of the day, and breakfast is so important. And now people are talking about intermittent fasting, and most of the time, you know, intermittent fasting will disrupt this old knowledge. So what's your opinion on that?
Okay, again, there's not only some mechanism may work for me and some may not work for the others. Okay, so what is fasting? Fasting is no consumption of the calories from mouth, because whenever that you think that you're fast, it's not meaning it doesn't mean that you're not feeding. Your cells are feeding continuously. They take glucose. You cannot stop glucogenesis inside your body. Your cells are going to just produce the amount of glucose that they need from the fat, from the carbohydrates, from the protein if it needs. Okay, so there's no problem with that. You are not going to have a very deep hypoglycemia if you don't have any specific problem or medications or something like that. Okay, so there are people that if they don't have their breakfast, they feel sick in the morning. So let them eat. But the main idea of fasting is that when you stay fast for a period of time more than 13 hours, it's the minimum length for having genesis of the ketone bodies inside your circulation. At least 13 hours to have the lowering of the glucose and high levels of ketone. And you know that all of your cells, except for the erythrocytes, can have their normal metabolism with no sugar, with no glucose. None of them use glucose. There is no proof that brain cells need glucose. No, brain can use ketone bodies. Okay, the only cells that. So if I stay fast and I have the rise of my ketone bodies, we know that this is good for lowering the insulin and having a better metabolism, and it is going to lower the level of the inflammation in your cells, in each single cells, and for sure lowering the inflammation inside your body is going to stop lots of the chronic diseases, aging, and cancer for sure. So if you cannot adopt the fasting, you don't have to do fasting. For sure, this is water fasting. You can have lots of coffee and tea or herb teas and water, but with no calories. So you can't have the juice, or you can have the maybe milk and so things like that. Okay, this is fasting if you do it for 24 hours. If it's not easy to make the adaptation, then you can start from 16 hours, which is the concept of intermittent fasting. And don't forget that our circadian rhythm is also very important in our metabolism. So staying fast during the day and eating at night, it's not very good with your hormonal circadian rhythm. So it's better to stop eating early in the evening and then stay fast till the noon, for example, at the next day. But no, it's not the rule. You don't have to do it. But the concept of having three main dishes and three minor between them, it's just nonsense.
Right, that makes a lot of sense. Well, thank you so much. Again, as a summary for anyone, if the connection was cut or anything, Dr. Babek was mentioning how everybody is different. So some people may not be able to fast for prolonged periods of time. And for those people, we do not recommend that they fast or pursue any change of their diet because everybody is different. On the other hand, for those who desire to fast and desire to increase the synthesis of their ketone bodies, because as we said, ketone bodies can feed every cell in the human being except for the red blood cell, except for the erythrocyte. For those who desire to do that and desire to experiment with the beneficial effects, they have to fast for a minimum of 13 hours because that's how long it takes for ketone body synthesis to start within the liver. As Babek Hoja concluded, as Babek Hoja concluded, the idea of breakfast, lunch, and dinner, the traditional idea, is not necessarily proven to be beneficial in any form or way. And so if a person is capable of experimenting beyond it, then there should be nothing stopping them. So as for the next question, Hojam, I was going to ask actually about, do you ever think that diets can replace medical treatments in the present or the future? I mean, right now, most of the research that we have shown, it's synergistic effects between diet and medicine. And synergistic effect, for those listening, means supportive, where one augments the other, and so they produce a larger effect. But Hojam, do you believe that in the future, diet can replace chemotherapy or radiotherapy?
Okay, in conclusion, no, but I hope. Let's start from the point that almost all of the diseases that we just search and try to know, try to understand, and in our aim, it's the cancer. Almost all of them have multifactorial etiologies. So we talk about the genetics, we talk about the environment, we talk about the maybe toxins, we talk about the previous treatments and the style of life and stress and cigarette smoking and all of that. So when your causes are multifactorial, so the treatment for sure has to be multifactorial. Know that there are people, there are societies in all around the world that have special maybe genetic differences or special types of feedings. For example, Maasais in the Africa, okay, they feed with meat, with fat, and with blood, and almost nothing else.
Wow.
And they don't have diabetes, and they don't have atherosclerotic cardiac disease, and they almost don't have cancer. So maybe yes, but this is not the way we are going to be able to live, because they don't have internet, they don't have pollution, they don't have stress, they don't have all of the problems that we have. So as our modern people and modern life, we have a lot of factors that affect us and cause cancer. Maybe stress is at the top of that. Maybe diet is not. But for sure, one of the biggest steps is going to be consuming normal food, real food, natural food, not something that come out from the factory, is not supplemented with lots of chemicals, not with the plants or animals that are hormonal feeded or not naturally feeded. So I'm not that hopeful that just with diets we are going to get rid out of cancer.
Right. Well, thank you for that. So as cancer is a multifactorial disease or origin, it requires multifactorial disciplines and treatment modalities. So it's too simple to just think of diet as a single unidimensional treatment option. That does not make any sense, even though, as you mentioned, exceptions exist deep in Africa where people have certain diets but no risks. But at the end of the day, we live, as you mentioned, complicated lives. And as a result, we have complicated issues such as cancer that cannot be treated with one single factor, which is diet. Professor, the next question is actually like in your clinic or in your day-to-day life, when a patient comes to you and approaches you to telling you, okay, I want to try out these herbal medicine options. I want to try out lots of tea or honey or garlic or curcumin or any of these herbal medicine options. How do you approach these patients? Because sometimes it's hard to tell them that, okay, there is no evidence about their benefit or harm, and they think that all of these herbs are harmless. So what's your approach towards these patients, and what do you advise us as future doctors to deal with them?
Okay, yes. First of all, unfortunately, there's a comic belief that if it is from nature, it's good. All of the talk from nature. Scorpions, lions, they can kill us. They're from nature, they're natural. So for sure it's not right. Belong to the chemotherapists because they give lots of chemicals to the patients. And for sure we have to be satisfied that the amount of herb or whatever that our patient takes doesn't have any interfere with the therapy. We know that lots of herbs that we use the, for example, system or other systems that can have adverse effects with the chemotherapeutics. So for sure, there are some of them that are prohibited. There are some simpler ones that we do have lots of research about them. For example, beta-glucan, for example, curcumin root. And we know that in some circumstances, they have a little immunomodulatory effect. So we let them use them. But again, there are some drugs that have some interference with them. So it's a dietitian or the internal medicines with the oncologist to decide if they can use them or not. But natural feeding, to me, is the first step. So get rid of all of those chemicals and the preservative chemicals that get into the feed. This is very important. Second, for trying to just lowering the act of TOR, don't try to take lots of protein. This is important also. Third, get as less as carbohydrates as you can. But for the herbs, you have to know about each of them. For example, you can use garlic for some cancers, at least with no harm. But we know that garlic has phytoestrogen inside that. So you may not advise the breast cancer patient to take it.
Wow. So Professor, what you're saying is that some of these, the belief that herbal medicine does not cause harm is absolutely false. There is no such thing that anything that comes from nature is healthy for us, and it's all okay to be used. And so if anybody wants to pursue the usage of this herbal medicine, whether it's curcumin or garlic or tea or honey, then what they should do is research them individually and understand that they might have benefits, but they might also have harm, and they have to decide along the way. But according to you, the priority of nutritious modifications starts with limiting the protein and limiting the carbohydrates. And then after that, we can think of other things like herbal medicine in small or, logical amounts. So Professor, as for our final question, we just wanted to know if you have any recommendation for us as youthful people and students over here. Do you have any recommendation for our diet or nutrition at such a young age, just as now?
Yeah. First of all, before recommending some nutrition, some recommendation about the thought. The problem with the science people is that if we can prove something and we do some, if we can schedule some research about some special condition and then prove that this is right, said, okay, I measured that and this is right. If I can't measure that as a scientist, I just ignore it. This is not right. This is not right. Try to always be open-minded to any possibility. Maybe meditation can cure something. Maybe just cure something. Maybe some breath workshops workings can help you to cure something and to correct something. And nowadays we don't have any data about that. We can't measure it. So scientists say that, okay, these are nonsenses. try to be open-minded to them. I don't say that try to accept them. No, you are science people. But try to always keep in mind that there might be something that I don't know. There might be something that still, as human being, we can't prove it, but it might be right. This can be right for the herbal medicine someday. This can be. Don't forget that lots of the drugs that we use are from herbs. We just purified them, and we know that what is the effect of the how many milligrams or micrograms of that over the body. So we are not against the nature. Okay, as young people, don't forget that as physicians, you need to have strong minds and strong bodies. So you have to just protect both of them. Nature likes flexibility, and nature likes adaptation. So try to be like that. I hate this. I don't want that. I exactly ignore this. Try to just get rid of all of this. Okay, you don't have to drink 3 liters of water every day to being healthy. But if you're thirsty, you have to drink water. That's it. Okay, you don't have to go and just make the push-ups for 1,000 times per day. But it's good to be active. Stay away from all of that that synthetic foods. Try to stay more close to the natural food. It's to me, it's the biggest step. But for sure, lowering the carbohydrates is good. For sure, trying to sense the fasting. Sometimes, not always. You don't have to. You do not have to do the intermittent fasting every day, but you can try it maybe once a week. And if it's not good for you, just leave it.
Wow, Hajam. So your recommendations for us are not only for nutrition and diet, but also for our thought process. So we have to be flexible, whether as doctors or people or even researchers. Don't stick to one idea. Do not hate something with a passion. Keep always an open mind to potential ideas and possibilities. And as for our diet, we can experiment because we're still young. Evidence right now shows that, okay, too much glucose or too much protein might be bad for us, so we can try it out. But at the end of the day, as long as we are getting rid of the synthetic products, as you mentioned, then hopefully we're on the right track. Professor, I believe that many of the people that are listening to us right now are going to be future researchers and great doctors. Do you advise such students to research this topic? Do you believe that it has potential? Would you advise them to look into it as a research topic?
Sure. It doesn't seem that we are going to end the cancer in the near future. It doesn't seem that we are going to end the obesity or the inflammation. So yes, I guess it is going to be very good. And beside that, I believe that whatever field of medicine that you love and you're going to work with that, don't forget that it is not. It is just the living patient in front of you. So his or her feeding, diet, habits, and style of life, and other things, psychiatry, psychology, all of them are very, very important. So you have to know about all of these matters.
Wow. Well, thank you so much. I would like to give an opportunity to the students listening now Does anybody have any question regarding this topic for Babek Hoja? I see Abdulrahman, you have your hand raised. Please go ahead if you have any question.
Hello, guys. Can you hear me?
Yes, we can.
Okay. Hello,
Yes, sir.
Hojam. I just wanted to ask about the first part of this conversation. We first started with talking about the ketogenic diet and how it might have a beneficial effect on cancer because cancer feeds on carbohydrates. But the ketogenic diet also has high fat and proteins. And, you know, proteins might also feed the cancer, but this high fat content can also lead us to atherosclerosis. Don't you think that having this ketogenic diet might open another window of harmful cardiovascular diseases to the cancer patients? Like he was just gonna die from cancer, now he's gonna die from cancer or atherosclerosis. So what do we do here? Don't you? I mean, I don't know.
Okay. Are you done?
I mean, yes, I just wanted to ask, is it actually like beneficial enough? Because like if we want to risk this, we might have the risk of atherosclerosis.
Okay, I got the question. Can I start?
Yes, please.
Okay. It's just a very good question, and we can start with the sentence that I made, that lots of data that we have from the past, from 1960s, 1970s, the American Heart Association and associations like that, that tell us that try to don't consume the fat and try to consume the cereals and carbohydrates, and because the high levels of cholesterol is going to kill you and cause the atherosclerosis. Nowadays, more and more research show us that these are not true. If you go with the saturated fats, which is the animal fat, and low carb diet, you are going to have lower amounts of triglycerides. You are going to have and lower amounts of VLDL, which is going to protect you against cardiovascular problems. Actually, as you see that from that time, maybe middle of the 60s, when Roosevelt had a myocardial infarction and his dietitian told the world that try to stop the consumption of the red meat and fats, and after that you are going to get rid of atherosclerosis, you can see that we consumed more and more carbohydrates, we consumed less and less animal fat, and we have more and more atherosclerosis nowadays. So when you go through the researches, you can see that none of them are very right, and lots of them are supported with the cereal companies and the companies that produce lots of sugar and things like that. And with the low carb diet, actually you have to keep in mind that you're not going to have lots of protein. Low carb diet is very low carb plus enough protein, which is something about 1 gram of protein per kilogram per day. Okay, it's not a lot, and you're going to have your energy from the fat. And if you don't take it enough, just you're going to burn your own fat, which is healthier.
Professor, I would like to add that while researching this topic, I came across one research that was talking about the effect of a ketogenic diet on people with arteriosclerosis. I'll be sure to send this research article to our friends who are attending this lecture. But the summary is that this research proved that actually, as you mentioned, the triglycerides, the blood glucose levels, and the cholesterol levels decreased on a ketogenic diet in patients with atherosclerosis, to your point, basically. So I'll be sure to share that with our friend Abdurrahman.
And don't forget that high levels of cholesterol is some clue of healing effect. When you need to heal some place, you need cholesterol. So this anabolic part is just an effect. It doesn't cause the inflammation. As far as you have high levels of inflammation, you're going to rise the cholesterol. And with ketogenic diet, with low carb diet and low insulin, low IGF, you're going to lower your inflammation level.
Mm-hmm.
Thank you very much.
Does anybody else have any questions, my friends?
I actually have a question, but I cannot raise my hand, so sorry for interrupting.
No problem, go ahead.
So first of all, thanks for the doctor for this is really good conference, by the way. I really enjoyed it, and there was like a lot of good information. And then it has been mentioned that so there are two important risk factors, which is our hyperinsulinemia as well as hyperglycemia. So I've been wondering for the patient with
hyperinsulinemia as well as
hyperglucose.
Hyperglycemia.
Glycemia, sorry.
Okay.
Hyperglycemia. So I've been wondering, patients with diabetes, are they at risk for every cancer? Because if they have both at the same time.
Type 1 or type 2?
I suppose type 2. But
Okay.
I would be happy if you could explain both of them. And thank you so much.
Okay. Type 2 diabetes starts with inflammation. You consume lots of glucose, and with your healthy pancreas, your levels of insulin is going to get high. When you have high levels of insulin, you're going to have inflammation. This is the beginning of the story. Okay? Beginning of the story is consuming lots of glucose and having lots of insulin. So if you have an opportunity to search these people's past history and they have some laboratory findings, you can see that the levels of CRP, and especially the sensitive CRP, the levels of fasting insulin and the insulin overall is high, but the level of glucose is low. So it comes to a physician like me, and I just check for the glucose. You can go, you can eat anything, but it's not true. The body is trying to lower the glucose. Why? While high levels of inflammation is causing de novo lipogenesis. I'm going to have fatty liver disease, even if I don't have the obesity. And I'm going to rise my visceral fat and so on. Okay? With time, when my beta cells getting weaker and weaker inside my pancreas, then I'm not going to be able to produce enough insulin to just depress the glycemic. And after that, I'm going to have rise of the glucose. At this time, they said that I have the insulin resistance. And if I just finish my beta cells and don't have enough amounts of insulin, then I'm going to have the hyperglycemia and type 2 diabetes. This inflammation is going to cause the chronic diseases like atherosclerotic diseases, heart diseases, hypertension, cancer, or any kind of maybe rheumatism problems like that. Okay? So it starts very fast, very early in their life. And with correction of the diet, when you don't consume the glucose, don't consume the carbohydrates, then you can have the normal levels of insulin and lower inflammation. And let me open another topic here, which you can just go and search about that a very, very big problem nowadays is the seed oils. Seed oils has no place in our metabolism. So all of the oil that you're going to consume is better to be animal oil, animal fat, plus
Hojam, could you repeat your last point, please, about the oil? The
yeah,
voice.
sure. Seed oils are that's our problem because they has no place in our metabolism. And for sure, you know that all of the products that you consume in the modern life are the products that are made with the seed oils. You can use coconut oil, you can use olive oil, and you can use the animal fat. But the others are all causing high levels of inflammation inside your body.
Mm-hmm. Could you provide us with some examples, please, about the other oils that we should be avoiding, like a couple of examples?
Sunflower, all of the seeds, soy oil, all of them. They're not useful. They're all harmful for the metabolism because they are unsaturated.
Mm-hmm.
When they get into the body, they want to be saturated. And for saturation, they need oxidation. You don't like to be oxidized.
That we don't. Do we have any other questions? Would anybody like to ask a question?
So the last question. I got the last question. Can you hear me, right?
Yes, we can.
Okay. So if we got a patient right now with diabetes, so what are the riskiest cancer that the patient has to be aware of?
Okay, patients with diabetes are at high risk of a couple of cancers. You can just mention maybe 70% of all of the cancers that they can have rise risk because of the hyperinsulinemia and hyperglycemia. So glucose is the external glucose that some toxin to your body. And the problem is that some sugar that might be worse than glucose is fructose. When you consume the sugar, it's 1 glucose plus 1 fructose. And these are going to cause inflammation. These are going to cause de novo lipogenesis, are going to cause obesity. These are going to cause hyperlipidemia and diabetes for sure. And the end result of this chronic inflammation may be atherosclerotic disease and cardiovascular disease and maybe cancer formation.
Thank you, Hojam.
Wonderful. So okay, we have another question. Umay, maybe unmute yourself. There you go.
Oh, okay. So my question is that you said you should use olive oils or like animal-based oils, but they say, for example, when you're deep frying something, there's this belief that if you deep fry something in olive oil, you shouldn't do that, and you should use like sunflower seed oil or something like that, because otherwise it becomes cancerogenic. What is your opinion on that, Hajam?
Yeah, really, I believe in that. That the seed oils must be manufactured inside the factories and put lots of chemicals inside them and push under pressure and lots of things to make them stable. Otherwise, you can't, for example, have a cottonseed oil to in your kitchen for a long period of time, or sunflower oil or nut oils and things like that. Okay, so you can see that there are people around the world that in little communities that they consume carbohydrates, but they don't get seed oils, and still that communities might be very healthy. So seed oils, yes, this is not good for your metabolism.
Even during the deep frying process, even like you want to have some deep fried chicken or something. So she asks, during the deep frying of food, does it change? Or the concept still remains the same?
There are something that you have to accept, that in modern life, if you don't use, for example, some chemicals, there are some modern okay, so yes, you just have to forget them. You're not going to eat, for example, candies, because they're not good for you if you are thinking about the low carb. You can cook lots of different types of meats and vegetables inside your oven, in the maybe boiled water or something else like that. But deep frying, yes, it's not good. It's not good. But don't forget that this is your life. You have to taste it. So drink. Sometimes maybe you can try something very sweet, sugary, but it must not be your lifestyle. What happens if you take a candy or chocolate tonight before go to sleep? It's not circadian, it's not low carb, it's lots of synthetic materials inside that, but you still are healthy. But your lifestyle, your feeding style must be healthier.
That makes a lot of sense. So moderation and, as you mentioned, flexibility. That makes a lot of sense. Does anybody else have any final questions before we wrap up? Hojam, do you have any final? Majd has a question.
Yeah. Okay. So, I'm sorry, Hojam. It's a quick question. It's a bit imaginative, and I believe it's a final question, and we'll wrap up with it. If you have, okay, for our young researchers, if you have one specific topic, specialized topic you want to research, you hope that it can be 100% confirmed, either it's a benefit or is it harmful, in your hands right now, what it would be exactly? It's a bit hard. I mean, if you can't think of anything.
Okay. In your own life, in your own medical life, you will consider that it is going to change maybe every week, every month. The more that you need, there are some new things that you get more considered about that. Okay, but for now, to me, maybe mTOR.
Thank you, Hojam.
That's the current secret for success in research then. Researching mTOR. Hojam, do you have any final words or recommendations for us before we finish this wonderful conference? Honestly, thank you so much.
It was just a pleasure for me to meet you. Thank you all for just joining this meeting. And take care. Take care of yourself. You're precious.
Thank you so much, Hojam.
Thank you, Hojam.
Thank you, Hojam. Thank you, everybody, for joining. Hopefully, we'll have more of these in the future. Thank you, everyone.